How precise are breast cancer biopsies? Breast cancer biopsies, especially core needle biopsies, are known for their high precision. Studies show that these biopsies have a sensitivity rate between 90% and 99%. This means they can correctly identify cancer in 90 to 99 out of every 100 cases where cancer is actually present. Core biopsies are particularly useful because they allow doctors to obtain tissue samples that help distinguish between invasive cancer and ductal carcinoma in situ, which is a non-invasive form of breast cancer. This level of accuracy is crucial as it helps avoid unnecessary surgical procedures and enables timely treatment planning. However, the precision of these biopsies can vary depending on the type of breast lesion being examined. For invasive breast cancer, core biopsies are very reliable, showing diagnostic agreement rates around 96%. On the other hand, when it comes to ductal carcinoma in situ, the accuracy is somewhat lower. Research indicates that the correct diagnosis from an initial core biopsy for DCIS occurs in about 65% to 80% of cases. This lower precision can sometimes lead to underestimation, meaning the biopsy might not fully capture how extensive or invasive the disease is. In some situations, this might requiring further surgical biopsies to confirm the diagnosis. False negative results, where the biopsy suggests there is no cancer when there actually is, are relatively rare but can happen. This occurs in about 2% to 3% of cases. False negatives are more likely when imaging results are suspicious, but the biopsy sample misses the malignant area. Therefore, it is essential to correlate imaging findings with pathology results and follow up appropriately to ensure an accurate diagnosis, especially if there are still concerns despite a benign biopsy result. The likelihood of a biopsy revealing cancer can also depend on individual patient factors such as age and imaging findings. Research shows that between 20% and 42% of breast biopsies detect cancer, with higher detection rates in older women. This reflects the increased risk of breast cancer as women age. In summary, breast cancer biopsies using core needle techniques are highly precise for diagnosing invasive cancer and reasonably accurate for ductal carcinoma in situ. However, some limitations exist. Careful clinical assessment and imaging evaluation alongside biopsy results are critical for optimal diagnosis and management. It is always important for patients to discuss their biopsy results and the next steps with their healthcare providers to ensure they receive personalized and accurate care.